guys, welcome back to another beautiful episode of my channel. If today is your first time of visiting my channel, you're welcome. If you're no subscriber, thank you so much for coming back. I hope you enjoyed my last video, and please, if you haven't subscribed to my channel, please kindly hit the subscribe button, turn the notification bell to get notifications whenever I post new videos. So in today I'm going to be talking about an important disease condition known as hernia. What is hernia? Hernia is the abnormal exit or protrusion of an organ from its normal position outside the abdominal wall. So we have 5 major types of hernia. The first one is inguinal hernia, incisional hernia, we have femoral hernia, umbilical hernia, and hiatus hernia. So in today's video, I'm going to be explaining these 5 types of hernia one after the So the first one I'm going to be talking about today is inguinal hernia. What is inguinal hernia? Inguinal hernia is the abnormal protrusion of the small intestine or fatty tissue into the groin through the abdominal wall. This type is usually common in men due to weakness in that area. So the second type is incisional hernia. As the name implies, incision means making a cut. So this type is usually seen at a site of previous surgery or where there is a surgical scar. There is abnormal protrusion of the small intestine through the abdominal wall at the site of previous surgery. So the third one I'm going to be explaining today is femoral hernia. Femoral hernia is the abnormal exit of a fatty tissue or small intestine into the canal carrying the femoral artery. This type is common in pregnant women or obese women, or you can even find it in women who have had so many children. So the fourth one I'm going to be talking about today is umbilical hernia. Umbilical hernia is common in newborn babies, and this type is where the small intestine passes through the abdominal wall near the navel. The navel is what some people call belly button. So the fifth one I'm going to be talking about today, which is actually the last one I'll be explaining today, is what we call hiatus hernia. Hiatus hernia is when the stomach, the upper part of the stomach, passes through the opening of the diaphragm into the chest cavity. So the diaphragm is actually a sheath of muscle that separates the abdomen from the chest. Okay, so let's talk about the causes of hernia. The causes of hernia includes pressure or weakness of the muscle. We also have lifting of heavy objects, especially those whose their work requires them to lift heavy objects frequently. Also, diarrhea and constipation can cause hernia. So the last cause I'm going to be mentioning today is persistent coughing and sneezing. So what are the signs and symptoms of hernia? The signs and symptoms of hernia include swelling at that site. There is bulging beneath the skin of the abdomen or groin. There is also shooting pain at that site. There is discomfort when bending or trying to lift an object. There is also dysphagia, which is difficulty swallowing. Also, there is heartburn and there is discomfort at that site. The signs and symptoms may differ in children. In newborn babies, there is bulge at the site of the hernia and they cry frequently. So the baby may also refuse to eat food. So what is the treatment of hernia? In newborn babies, it may resolve on its own within 4 years without any surgery. But in other persons, there is need for surgery. There is a standard surgery for it, which is known as herniorrhaphy. I hope you found today's video useful. If you found it useful, please don't forget to give it a thumbs up. Don't forget to like and comment on my videos. And please don't forget to share my videos. If you haven't subscribed to my channel, please kindly hit the subscribe button, turn notification bell to get notifications whenever I post new videos. I hope to come back with a wonderful topic again. Thank you so much for watching my videos.